We start with the growing battle over a possible billionaire tax in California, and now a push for a national billionaire tax from Governor Gavin Newsom. The state proposal will officially appear on the November ballot for California voters to decide. It would put a one-time 5% tax on the assets of Californians whose net worth is at least $1 billion. Most of the money would go to health care. The rest would go to education and food assistance. Governor Gavin Newsom has been against this, and after failing to block it from the ballot, he proposed a wealth tax of his own on the national level. He has no power over federal lawmaking, but has said he is considering a run for president. His office sent us a statement in part saying, quote, "The fight to make the wealthiest Americans pay more in taxes is not one we should be fighting state by state." We'll see what happens with that national effort, but we start with the state measure. I sat down with David Regan. He is the president of the SEIU United Healthcare Workers West, which did all the work to get this on the ballot. Here's what he had to say. I mean, the governor, though, and other opponents of this, I think they're trying to make the point that a billionaire tax in one state just means that these wealthy people can get up and go to another to avoid this tax. I mean, you're not worried about that at all because, I mean, they're claiming it could be a huge loss in state funds for everything.
Well, their claims are entirely fabricated. There is absolutely no evidence that billionaires leave. Billionaires are the wealthiest people on the planet. They can live wherever they want in the world, let alone in the country. And all of the evidence, all of the research, all of the data that we have is that the very wealthy make this argument every single time. They most recently made it in the state of Massachusetts that passed a tax affecting millionaires. And today there are more millionaires in Massachusetts than there were when the tax passed. And everybody said they were going to go to New Hampshire and they were going to go to other states. It's just not true. The governor can say it as many times as he wants, but the facts are not on his side. So
you don't believe the billionaires who made arrangements earlier this year to leave, you don't think they're actually leaving?
No, I don't. And the other thing that's worth saying is that the tax that we're proposing is a one-time tax based on whether or not someone was a resident of the state of California on January 1 of this year. So there is no incentive for billionaires to leave. Their status as a legal resident is already ingrained. And so even to pursue the idea that there's incentive to leave is just false. And all of the evidence, again, tells us that it's not true. And there's no reason to believe that these claims are true either.
And I mean, critics say, I mean, just to hone in and to basically get you, can you guarantee that this isn't going to be an everyone tax, essentially, as some people are claiming it would be, something that's going to impact everyone with a potential loss in funding? Like, you're prepared to say that's not going to happen. SEIU-UHW can guarantee that.
Absolutely. This is a one-time emergency tax to address the collapse of our healthcare system in California and the loss of healthcare coverage for 3.5 million people. When it's passed, it will raise $100 billion to address that specific problem that no one, including the governor, has a solution for. The idea that putting $100 billion into the healthcare system to keep millions and millions of people in a secure position and facilities and clinics and hospitals open, this is adding revenue for a critical core thing. And the idea that somehow $100 billion more is going to be less doesn't make any sense. And I don't know why they're allowed to make these really nutty claims. There's no other way to characterize it.
So on the other side of this, the California Medical Association is just one of several groups against the proposed tax. I spoke with the president of that group, Dustin Corcoran. Here's part of our conversation. So why is the California Medical Association against this billionaire's tax being proposed by the SEIU-UHW?
It's not for lack of support for new revenue and for different revenue ideas. Over the years, we've supported the tobacco tax. We supported Prop 55, which increased taxes on high-income earners. Most recently, the MCO tax. This tax is very different because it's one-time in nature, and it will actually cost the state of California more money over time than it'll bring in. And from a healthcare perspective, you really need revenue that's ongoing, durable, and sustainable. And this tax doesn't meet that measure.
So when the SEIU-UHW threatens like hospital closures, shortfalls and shortcomings in our healthcare system, if this isn't implemented and imposed, I mean, what's your response to that?
Well, UHW has identified the right problem, but very much the wrong solution. Hospital closures are real. Their HR1 puts healthcare in California under extreme duress. Millions of Californians are going to lose their health insurance. And what we should have done is had a real collective response to that as a state. Instead, we had one person, one organization go off on their own, create a ballot measure that wasn't stress tested with anybody else, wasn't thought through with anybody else. And now we have a litany of analysis that shows that it's not going to deliver what it promises. In fact, will hurt healthcare in California more than it'll help.
Are you involved in negotiations? I mean, from your standpoint, are negotiations even happening really on this?
Not particularly in a true sense of negotiations. That's not what's going on right now. What we're doing as an organization is pointing out the dangers of HR1, the dangers of Donald Trump and what he means to the state, but at the same time looking forward to make sure that we defeat this measure and that we have a real conversation about needed revenue on an ongoing basis.
So CMA is going to actively fight this tax?
We are.
Okay. And I mean, with the landscape right now, with our state's revenue situation, the budget, I understand the state already heavily relies on the wealthiest earners for most of the money the government uses. But I mean, how should this situation be handled with HR1?
Yeah, with HR1, I think, again, we need a broader conversation about ongoing, durable, and sustainable revenue. This ballot measure proposes a one-time influx of dollars. I don't think any of us can say that the state of California has done a great job of making sure that when we have spikes in revenue, that we actually save and we smooth that over time. This would exacerbate the highs and lows that we experience as a state in terms of revenue. A broader conversation that ought to be had by state leaders, by stakeholders, by those affected by the cuts of HR1 would be, how would we handle over a multi-year period of time the cuts of HR1 to make sure that the citizens of California are getting the health care that they need and they deserve.
Again, this proposed tax is meant to generate $100 billion in revenue. You can watch my full conversations with both David Regan and Dustin Corcoran right now on CalPolitics360.com.